Look, if your periods feel like a monthly medical emergency, if you find yourself constantly planning your entire life around heavy bleeding, sheer exhaustion, or that awful nagging pelvic pain, I want you to know right now in the exact right place. As a medical doctor, I sit across from patients every single day who are just completely drained physically and emotionally exhausted from constant dismissal. You know, maybe your stomach keeps growing but you aren't pregnant and you've had to feel those incredibly uncomfortable questions about when you're due. If that sounds familiar, this video is made specifically for you. We're going to change that narrative together. We're going to take a calm, clinical look at exactly why you have fibroids and really understand what's going on inside your body.
It's time to take the fear completely out of the equation. The second people hear the words tumor or growth, it's human nature. Our minds immediately jump to cancer, fear, and worst-case scenarios, like inevitably losing your womb. So let's alleviate that panic right off the bat. Fibroids are benign. They are not cancer. They simply don't behave like aggressive, malignant cancers that spread throughout the body. The overwhelming majority stay right there in the uterus and just grow very slowly over time. The risk of cancer is incredibly low. Understanding that fact is step one in taking your power back.
What are fibroids exactly? Let's break down the actual anatomy here. So the formal medical term is uterine fibroids, or leiomyomas. Think of a healthy uterus like a highly resilient muscle. It's almost like a really strong balloon made of thick, smooth muscle fibers. I mean, it's designed to stretch and grow during pregnancy. But sometimes a little group of those cells starts playing by its own rules. Instead of staying nice and smooth, they overgrow and sort of bunch together into a firm knot. That localized knot of muscle and connective tissue, that's your fibroid.
And these growths, they vary wildly. It's definitely not a one-size-fits-all situation. Some are microscopic, like a tiny seed that you'd only ever find by pure accident during a routine ultrasound. But others, they can grow to the size of a grapefruit, or in really severe cases, literally the size of a watermelon. You might just have one rogue fibroid, or a whole cluster of them growing all at once, stretching out that uterine muscle in some seriously uncomfortable ways. The question everyone asks, why did I get this? My patients almost always ask if it was something they ate, or because they were on the pill, or because they didn't have kids early enough. The truth is much more scientific than that. While the medical community hasn't found one magic root cause, we do know fibroids are driven by a complex mix of four things: hormones, genetics, lifestyle, and environmental factors. It's essentially a massive biological puzzle. Let's talk about hormones for a second. Think of estrogen and progesterone almost like fertilizer. They don't create the fibroid out of thin air, but man, they certainly encourage it to grow. During your reproductive years, when those hormone levels are naturally peaking, your uterine cells get highly stimulated. It feeds the fibroids. This, by the way, is exactly why we see fibroids often shrink right after menopause. The hormonal fertilizer has basically been shut off.
But hormones are just part of the story. Genetics play a massive, absolutely crucial role here. If your mother had fibroids, your chances of developing them shoot way up. The same goes if your sisters, your aunts, or grandmothers had them. Simply put, this condition runs in families. You inherit a biological predisposition to them, woven right into your DNA. And I need to deliver this next fact with the absolute gravity it deserves. Black women are disproportionately affected by fibroids. Clinical research consistently proves that Black women are significantly more likely to develop them. They get them at much younger ages. The fibroids grow larger and they occur far more frequently. Yet tragically, despite having the most severe clinical presentations, Black women face the highest rates of medical dismissal. They're often told to just lose weight or that they're exaggerating the pain. This delays diagnosis for years while those fibroids just keep growing and causing more devastation. Now, beyond genetics and hormones, there are a few other triggers. Excess body fat can actually increase estrogen production, which just adds more of that fertilizer. Chronic inflammation from ultra-processed diets and even long-term chronic stress can severely upset your hormonal balance. And we can't forget endocrine-disrupting chemicals, stuff found in certain daily plastics and cosmetics, which can literally interfere with how your body processes hormones, creating a prime environment for fibroids to thrive. But listen to me. Most importantly, you did not cause this. Fibroids are not some kind of spiritual attack. They aren't a punishment for something you did, and they sure aren't caused by laziness. They are absolutely nothing to feel ashamed of. This is a legitimate medical condition, driven by complex biology that is completely outside of your control. So if you're carrying any guilt about this, I want you to let that go right now.
Warning signs you cannot ignore. Let's look at the actual physical toll this takes.
One of the most glaring signs is unusually heavy bleeding. And look, we're not talking about a standard heavy flow day. We're talking about bleeding right through your clothes, having to change a pad every single hour, and passing blood clots that are frankly frightening. Over time, that extreme blood loss leads to iron deficiency anemia. Your body literally runs out of the healthy red blood cells it needs to carry oxygen. So you're not just tired. This leads to debilitating exhaustion, dizziness, weakness, and massive mental fog. Your body is quite literally starving for oxygen. Another huge warning sign is pelvic pressure and abdominal enlargement. Sometimes people call this a phantom pregnancy. Because these muscle knots are so firm and large, your lower stomach actually starts to protrude. It feels heavy, it feels hard, your normal clothes just stop fitting altogether. And as a doctor, let me just validate the deep emotional trauma of walking around with a protruding stomach and having strangers constantly asking if you're expecting a baby when you're not. It's a heavy emotional trauma layered right on top of a brutal physical one.
And then, of course, there's the pain. When fibroids grow, they don't just politely sit there in empty space, they press hard against your surrounding anatomy. They trigger severe pelvic cramps that can literally leave you curled up in a ball on your bed. They press against nerves, sending shooting pain down your lower back and legs. If they press forward onto your bladder, you're running to the bathroom constantly. If they press backward, you're dealing with severe bowel issues. And crucially, they can cause deep, sharp pain during sex. Listen, pain that disrupts your daily life or your intimacy is a massive medical red flag.
Which brings us to a really fundamental clinical truth. You have to listen to your body. Fibroids present totally differently in every single person. One patient might have a tiny little fibroid that causes agonizing pain just because of the specific nerve it's pressing on, while someone else might have a watermelon-sized growth but only feel a dull heaviness. It doesn't matter what it looks like on paper. Your pain matters. Your discomfort is valid. Understanding different fibroid types and why location actually matters a lot more than size. I want you to think of the uterus like a house. It's a great way to visualize this. Different fibroids grow in different rooms or areas of that house, and depending on where they decide to set up shop, they affect your body in very, very different ways. First up, we have subserosal fibroids. These grow on the outside surface of the uterus. Think of it like an addition or a bump growing outward from the exterior wall of the house. Next are intramural fibroids. These are actually the most common type. They grow right within the muscular wall of the house itself, kind of like a knot buried deep inside the wood of the wall. Then we have submucosal fibroids. Now these grow directly into the inner cavity of the uterus, the most sensitive central room in the house. And finally, pedunculated fibroids. These are attached by a thin stalk, hanging almost like a piece of fruit from a tree branch.
Now, what's really interesting about this is how perfectly it maps the relationship between the real estate of the fibroid and the exact symptoms you might be feeling. Let's look at subserosal fibroids first. Because they grow outward, they start pushing against nearby organs, like your bladder. That's what causes frequent urination, that heavy pelvic feeling, or back discomfort. It's all about pressure. But look at submucosal fibroids. Because they grow into that sensitive inner cavity, they are strongly linked to extremely heavy periods, severe clotting, and prolonged bleeding. Honestly, a tiny fibroid in that inner cavity can cause massive bleeding, while a much, much larger one on the outside might just mean you need to use the restroom a little more often. It really is all about location.
Pregnancy and fertility facts. This is where we need to separate fear from reality.
Will I still be able to get pregnant? It is without a doubt the very first question that comes to mind for so many of my patients. It's the thought that keeps you awake at 2 a.m. The panic sets in, usually fueled by a bunch of horror stories you've read online, and the immediate assumption is that the door to motherhood has suddenly just been slammed shut.
I want you to truly, deeply hear me when I say this. You are not automatically infertile because you have fibroids. Please let that sink in. A fibroid diagnosis is not the end of your story. Countless women with fibroids conceive naturally, they carry perfectly healthy pregnancies, and they deliver beautiful, healthy babies every single year. In fact, some women don't even know they have fibroids until they're already pregnant and see it on a routine ultrasound. So, the crucial point is understanding how and when they might cause an issue. Remember our house analogy from earlier? Think of the inner cavity of the uterus as a nursery being prepared for a baby. If you have large submucosal fibroids, which is essentially like having large, clunky furniture blocking the space in that nursery, it naturally becomes harder for an embryo to settle in comfortably. Fibroids can sometimes distort the shape of the uterine cavity, making implantation difficult, or they can increase the risk of a miscarriage. Sometimes, Large fibroids might also lead to preterm labor or cause the baby to be positioned abnormally. But, and this is a big but, please remember that an increased risk is absolutely not a guaranteed bad outcome. Proper medical evaluation can easily determine if these fibroids need to be addressed to, clear out that nursery space before you try to conceive. Managing fibroids naturally. We're going to look at facts versus fiction here.
And this brilliantly illustrates the stark contrast between fantasy and reality. On one side, we have the internet myths. Let me be unequivocally clear as a doctor. There is no magical tea, no 7-day shrinking detox, and absolutely no secret miracle drink that's going to melt away your fibroids overnight. Anyone trying to sell you that is simply exploiting your fear. On the flip side, however, we have evidence-based support. Now, while natural approaches won't cure fibroids, making specific lifestyle changes is incredibly powerful. It helps support hormone balance, reduces inflammation, and can seriously improve your daily symptoms.
So let's walk through these actionable, medically backed steps you can actually take to support your body. First up, weight management. Body fat produces estrogen, and fibroids, well, they feed on estrogen. So maintaining a healthy weight helps keep those hormones in check. Second, an anti-inflammatory diet. Loading up on fiber and cruciferous veggies, things like broccoli and kale, really helps your body metabolize that excess estrogen. Third, we need to look at correcting vitamin D deficiencies and eating iron-rich foods. This is absolutely critical to combat the anemia that often comes from heavy bleeding. And finally, gentle, regular exercise and strict stress management. High cortisol levels from chronic stress literally fuel inflammation in the body. Taking the time to sleep and rest, that's not a luxury. It is a clinical requirement for your reproductive health.
Medical treatment options. These are tailored to your specific needs.
Let's see how this builds, because when natural management just isn't enough, we step up our care based entirely on your symptoms. Step 1 is simply watchful waiting. If your fibroids are small and totally painless, we don't rush into anything. We just keep an eye on them. Step 2 brings in medications. These might be hormonal therapies or GnRH agonists, and we use those to manage heavy bleeding or to temporarily shrink the fibroids. Step 3 moves to minimally invasive procedures, like uterine fibroid embolization or UFE. This actually cuts off the blood supply to the fibroid, effectively starving it without the need for major surgery. Step 4 is a myomectomy. And step 5, which is the final and most definitive option, is a hysterectomy. Now, comparing those last two surgical options directly is really important, because this is the point where many patients feel the absolute most anxiety. A myomectomy is a surgery that removes just the fibroids while leaving the uterus completely intact. This is absolutely the preferred surgical route for women who want to preserve their fertility for future pregnancies. A hysterectomy, on the other hand, is the complete removal of the uterus. It is the only 100% permanent cure for fibroids. They literally cannot return once the uterus is gone. But of course, it has a profound emotional impact and it means the end of fertility. So there is no one-size-fits-all answer here. The best choice is always the one that aligns with your specific symptoms, your life goals, and the quality of life you want to have.
This is all about advocating for your health. I need you to listen closely to this. Do not ignore these red flag symptoms. If you are soaking through pads every single hour, that is a red flag. Passing large blood clots. Pelvic pain that is so bad it forces you to cancel plans or call out sick from work. A rapidly enlarging stomach. Constant, debilitating fatigue where you just can't get your energy back. Or unexplained struggles to get pregnant. Listen to me. Do not let anyone, and I mean anyone, tell you that this kind of agony is just part of being a woman. It is not normal, and you absolutely do not have to accept it.
I want to completely remove the fear of the unknown for you right now by showing you exactly what happens when you come into the office for a medical evaluation. Step 1 is just a simple conversation. We sit down face to face and we talk extensively about your menstrual history and the pain you've been experiencing. Step 2 is a physical pelvic exam, just to check the size and shape of your uterus for any obvious irregularities. And step 3 is imaging. We'll use a painless ultrasound or maybe an MRI to basically draw a map of the exact size and location of your fibroids. It is a straightforward, safe, and incredibly revealing process. There's nothing to be afraid of.
As a medical professional, if you take nothing else away from our time today, let it be this message. Severe suffering should never be accepted as routine. You deserve to be heard. You deserve doctors who actually listen to you without dismissing your pain or brushing you off. You deserve to be respected. And most importantly, you deserve to be properly treated so that you can finally reclaim your quality of life. So, what does this all mean for you moving forward? I'll leave you with this final, powerful thought as we wrap up this explainer.
What step will you take today to reclaim your health, to start tracking your symptoms, and to demand the care you truly deserve? Remember, knowledge is your absolute greatest power. Don't let fear hold you back from making that appointment. Thank you so much for joining me today. Take excellent care of yourself, and I look forward to guiding you through more fascinating medical explainers in the future.